Good evening, everyone. My name is Anteria Burgess, and this evening I'll be conducting my persuasion speech on mandatory AIDS testing. I myself agree that mandatory AIDS testing is an excellent idea. I agree with the notion that we should know who in our community, that more so policymakers and researchers should know who throughout our community, or more so how many people throughout our community are being affected with this crippling disease. Now, my first question is, do you know who's affected with AIDS? Can you stare someone in the face and look at their physical characteristics and determine that they are carrying the virus? Do you know if your uncle has AIDS if he hasn't told you? Do you know whether or not your close friend has AIDS if she hasn't told you? The answer is no. Truth be told, you cannot look at someone and determine from their physical characteristics that they are suffering with HIV or AIDS. Now, there are approximately 1 million people living throughout the U.S. carrying the HIV virus. That's according to vital statistics. Since its discovery, HIV has spread throughout the United States communities in alarming rates. With no cure for HIV or AIDS, it's leading to self-destruction amongst mankind. To help combat the issue of the disease continuing to spread, HIV testing should be mandatory for those seeking routine medical examinations. The practice of mandatory HIV testing will only bring more awareness to the crippling epidemic which faces this entire nation. HIV is the acronym for Human Immune Deficiency Syndrome, which is the virus that causes AIDS. AIDS is the acronym for Acquired Immune Deficiency Syndrome. The contraction of HIV can occur from one person to another through blood, semen, vaginal secretions. Pregnant women have the ability to pass the disease along to their unborn child. A mother can also pass the disease along to her newborn through breastfeeding. Now, since its introduction into the United States in the early 1980s, HIV has become known as the greatest threat to mankind. This news is according to The Origin of AIDS, which was an article posted back in 2008. HIV causes a person to lose all control over the protection of their immune system, which in return leads to a number of health problems. Over time, the disease becomes more serious as it goes on, and the person just becomes unable to fight off diseases. And by this time, HIV has turned to AIDS. This process of HIV transitioning into AIDS may take a number of years. The amount of time the transition takes is normally about 8 to 11 years, but it basically depends on the person. However, this prolonged process results in a person carrying the virus for a number of years before they have any visible symptoms, or before they themselves even become aware that they are carrying the virus. Because of the seriousness of HIV and AIDS throughout the United States, the subject of mandatory testing has long been a topic of discussion by lawmakers. The suggestion of mandatory HIV testing continues to face rejection because people do not want a breach of privacy. They feel as if their health state is their business. And also just the stigma attached to those people that's carrying that disease. People suffering from the disease are often scorned, they're discriminated against by employers, and they fear facing a possible rejection from family and friends. The media and other news sources often portray individuals suffering from the disease as abnormal, which results in some members of society kind of shying away from those suffering from the disease. People also just present the fear that their information will be made public, and this will increase that discrimination against them if they have the disease. This stigma attached with carrying this disease leaves most people to just simply not want to be tested. They refuse to know their status. Now, according to the World Health Organization, they determined that it is just unconstitutional to impose mandatory testing of any kind. I myself think, is it more logical to continue to consider the feelings or the emotional state of someone carrying the disease rather than to think of our country as a whole? By imposing mandatory testing, no one is pressured into taking the test or, you know, forced to come into a doctor's office to be tested. However, when they do come in for a regular health screening, this test will just simply become a part of that screening. Now, by performing routine testing, this will allow researchers more accurate information as to how many people are actually living throughout the U.S. and are affected with the disease. Now, this information will help determine what's even causing the spread of the disease. Now, in addition to helping the nation with an early diagnosis of HIV, individuals will also be helped as a whole. Their medications, which can be administered to the patient, will be given to them, and this will help prolong their life. Many believe that involuntary testing of HIV is just a violation of their constitutional rights. They contend that testing without their consent seems to take away from guaranteed freedoms. However, in order for the U.S. to understand and fully understand the impact of the HIV and AIDS epidemic, there needs to be accurate information as to who's infected. We must know who is infected. By knowing the numbers associated with suffering from HIV, policy members and researchers are equipped with useful information to assess what methods, can be deemed as effective and ineffective with preventing this disease. Researchers believe that early diagnosis and treatment of HIV disease may even delay the onset of age, which gives the patient a longer lifespan. By diagnosing individuals sooner, they are allowed to receive sufficient medical attention in order to help them lead a more seemingly healthy life. By receiving a diagnosis before symptoms begin to occur, patients are allowing the replication of the virus to slow and are improving their immune system functionality and are able to prevent some opportunistic infections. There are several studies which support this information that the earliest the diagnosis is, the more help the patient can receive, the longer that they can live. Now, the HIV virus does carry a negative connotation for those who carry the infection that no one basically wants any association with. However, the HIV virus, it kind of brings shame to the person in the family who's infected, because it can be paired with promiscuous homosexuality and drug addiction. This stigma scares away people from wanting to know or searching for the truth of their HIV status. But by imposing mandatory testing, the U.S. will be better able to understand what areas are most infected, what people are most infected, what culture of people are most infected, the age group of these people, and it'll just better help our culture. Also, by understanding the disease, we can begin to breach the barriers and eliminate the stigmas associated with those who are affected and those who are not. Thank you.